Thanks for joining us for this symposium. I'm Bill Rapisi, President and CEO of the Lymphatic Education Research Network. LE&RN's mission is to fight lymphatic diseases through education, research, and advocacy. In order to win a fight, you first have to join it. So we ask, please become a supporting member of LE&RN at lymphaticnetwork.org. And we hope you enjoy today's symposium.
So hello, everyone. So thanks a lot to the Lymphatic Education Research Network for inviting me to share our work on designing robotic textiles. And in this specific talk, we'll discuss a project in which we're designing for the rehabilitation of KnitDema. And So we want to, the LE&RN Symposium wants to acknowledge the generous support of these entities below for their support. And this is also a disclaimer. So the information provided in these seminars is meant to be just informational, and so please consult your primary care provider for personal health. And so jumping today into my talk. So my name is Hsin-Liu Kao. I am an assistant professor at Cornell University, where I direct the hybrid body lab. So we are a interdisciplinary research lab focused on designing wearable interfaces that are conformable, or in other words, soft. And they often can sit directly on the body surface. And here are, I think, just a quick snapshot of some of the projects that we work on. And in leading my research lab, our work is highly interdisciplinary. So here's a snapshot of the lab members, and they really come from a lot of different disciplines, spanning engineering, computer science, and also textile design, interaction design, etc. And I hope that today in this talk, the different blending of disciplines that comes together in this project will also be interesting for this audience. And so in our work, we have providing just a quick overview of the type of research we do. We work on three main thrusts of research investigation under this large umbrella of soft interfaces. We like to call them hybrid skin. So one is, of course, on-skin interfaces. These are also things such as smart tattoos for monitoring health, etc. Of most relevance to today's seminar is our work on robotic textiles. So we're very interested in thinking about how we can create robotic textiles that are very close to the human body. And by definition, robotic textiles are textiles, right? We're all wearing fabric clothing today, but think about like fabrics or textiles that can be integrated with actuators, so that with these integrated actuators, these textiles can now actually move and deform in different ways. And so this is the line of work that is very relevant to our discussion today. We also work on a lot of toolkits to enable more people to be able to fabricate these devices. And as I will also talk about in the second half of my talk, we also aim to let, for example, clinicians who are working with patients and treating KnitDema to also be able to be involved in some of the design and decision processes of some of these robotic textile devices that we are thinking of. And so today, I would like to focus on this research project on designing robotic textiles for KnitDema rehabilitation. And this is really a collaboration between my lab, the Hybrid Body Lab, and also the rehabilitation department at all Cornell Medicine. And especially our clinical collaborator is Dr. Joan Stilling. And she, and as I will share a little bit more, so I think this co-design process involving more engineering or design researchers, such as myself and the folks in my lab. This code between us and these medical clinical experts has been very, very important in guiding the design of this device. And so, as we can see here, here are the hands from the same person, right? But we can see how this hand on the right is significantly more swollen. And so, in our motivation for this project, we are very interested in thinking about how we can use small actuators integrated and in this specific application knitted into textiles to provide sequential compression to help treat hand edema. And current conventional treatment approaches of edema include, of course, using a pneumatic sleeve. Here's an image. Manual massage is also quite common, especially if it's for the extremities, such as fingers and toes, because pneumatic sleeves might be too bulky. Compression gloves that can be purchased off the shelf are also used, but they provide significantly less compression force to the hand. So they're typically used mostly for management of conditions. And so in our work, we're really interested in thinking about how through the design of a robotic textile device, we could create a hand edema treatment device that's portable, personalized, and also much more accessible to people who, for example, might not have the resources to come in to a clinic to get a more costly manual massage session. And this work is really situated within prior work thinking about current edema treatments in practice. There are also some recent work in robotic textiles for medical applications, and we also like to take a co-design approach in thinking about how we can create a robotic textile in collaboration with clinical experts. And so current edema treatment approaches, one very common approach is using a pneumatic sleeve. However, we can see how it's bulky and it can be quite cumbersome, right? And especially if today you're suffering from edema of the digits in the fingers or your toes or ankles, so these more intricate body locations, because just of the size of the pneumatic sleeve, it's hard for it to be treated properly. Manual massage is actually a very common approach for hand edema. However, we can quickly imagine how the cost of getting a manual massage by a certified physical and occupation therapist can be very high, and also just the limited amount of resources, right, to be able to get this type of treatment and the potential barriers towards health equity for people, who might not be able to make it into a clinic. There are also other methods, right, including using different types of machines or manual taping, and also gloves, isotoner gloves. However, it's typically more for management, or again, just bulky and hard for us to access. So I think we were really trying to think about the potential to create a portable approach that a hand edema patient could potentially take back home with them and to use it, for example, throughout their workday. So they might be able to, as prescribed by their clinician, maybe just put on this device and to be able to use it multiple times a day. Another very important set of related work is thinking about how we can, for us as human-computer interaction researchers, how we can co-design with clinicians. And we're very interested in involving more stakeholders into the creation process and involving them not only in, of course, the usage, right, and the the final deployment of the device, but also from the very beginning in the design phase. The field of robotic textiles it's really an emerging realm. There have recently been more and more work in this space looking at robotic textiles for medical applications, and we really also build on this work. However, what I think a very unique aspect of this project is we're actually bringing this robotic textile into user studies with persons with hand edema to actually understand, right, how someone with a hand edema condition might perceive and also react to such a device. And so next, I'll go in more detail about the hand edema system. And this project is in many it involves many phases, and so I'll talk about our early efforts and also in creating a first prototype. And so, of course, for this hand edema device, our ultimate goal is to create a whole hand device, right, that can cover the entire hand and to provide sequential compression. However, as an early investigation of the feasibility of this approach, like, does it even make sense? Do people find it promising? This is an early prototype where we're focusing on the principal component of a single finger. And of course, as I will discuss, we'll also expand this to the palm and ultimately to the whole hand. And so in this work, the KnitDema device, as you can see here, it consists of an active compression sleeve. And in this knit sleeve, there are integrated very, very thin yarn-like shade membrane nitinol actuators that when activated, they can contract and provide compression on the finger. So this is a very important element, really enabling the robotic textile properties. There is also a passive sleeve, which refers to the knitted sleeve, right? And we experimented also with a lot of different yarn properties and knit structures to really find the most suitable level of compression and also comfort for the end user. And of course, last but not least is the hardware printed circuit board, really enabling the programming, right, and the control of this device. And in designing this early prototype, I just want to quickly show our co-design process, right? So from the beginning of the brainstorming and trying to narrow down a suitable target area that might be underexplored in edema treatment, narrowing it down to the hand, and also this iterative prototyping to get to this initial device. So it really involved a very close collaboration and also co-design process with our clinical partners at Cornell Medicine. And so next, I want to go into a little bit more detail on each of the components of the robotic textile. So the first is the passive compression element. And as you can see on the right, this is knitted through a digital knitting machine. And so we are able to control all the parameters that are forming this knit substrate. And so in terms of the knit substrate itself, it consists of course, as you can see here, these integrated actuators. And so we developed a knit approach to be able to knit these very, very thin channels in the knit structure itself. And then we would then be able to thread the shade memory actuators into these very, very tiny channels, right? And then also examining different knitting techniques such as shaping and interlock so that it can be much more conformable and personalized to the individual's hand. And a very important property, right? A lot of different properties that we had to examine was like, yarn properties. So there's a lot of different types of yarn materials. So we landed with using a combination of elastic versus non-elastic yarns for just for the amount of suitable amount of passive compression, but also comfort, different knit structures, the different loop length, and also I'm doing a lot of fitting tests, right, to make sure that this glove that we're knitting conforms well to the hand. So beyond the knit substrate itself, I think a very important element is, of course, active compression. And this refers to integrating these shape memory actuators, right, into the knit substrate, right? And there are a lot of important parameters that we can imagine, right? Now you have these array of actuators, right, across currently in this prototype, one finger, but eventually we would like to have these actuators integrated in all fingers and also the throughout the palm in a way that also makes sense considering the lymphatic drainage. And one very important thing is actually to think about the compression, right? So once we can have several of these yarn-like actuators in the hand, how long should we compress each of them? Should they all be compressed at the same time or different time, et cetera? And so this is what we refer to as the compression parameters. And so we did a series of studies to try and understand what would be the most suitable fluid displacement strategy in terms of actuator compression. And this was, again, also through very, very close collaboration with our clinical experts at Cornell. And so you can see here what we created here is we created a mock finger. So this is, you can think of it as a mock finger fluidic system, right? And it has a outlet here that can go up in the barrette. And so what we're doing is we're testing a lot of different parameters to understand how we should actuate these array of actuators. And also in terms of treating hand edema, we want the endogenous fluid to really flow back towards the heart. And so understanding, right, for example, the band interval, right, how many actuators do we need, right? And then how, like, should we, like, have some pause between actuating each of them or not, sequence interval. So after we actuate all of them, do you want to pause or we just do another sequence, the duration of actuation. So these actuators, we can actuate them from, so we actuate each of them for like just 15 seconds, 30 seconds, 45 seconds, etc. And also just the number of shape memory alloy actuators. And of course, this also is also closely tied to comfort, but also some of just the technical limitations about like how many channels we're able to knit and also the size of the actuators, etc. And so what we found was it was most ideal to not have any intervals, so any breaks between each of the actuators, actually, and also between each of the sequences. So, just to continuously actuate is best, and also compression duration. So also through our test with the mock finger setup, we found that 105 seconds for each ring would generate the most amount of fluid displacement. And also just the number of SMA bands, right, throughout a finger. And in our displacement, fluid displacement, we also found that the most ideal number of SMAs throughout the finger would be 6. And so this is kind of like what we landed on in this final early prototype. And so we wanted to do an early feasibility user study to understand, does this like, what does it do? Like, is it actually comfortable to wear? And can it actually work? So again, this is not an efficacy study, but an early feasibility and safety study. And so I'm just going to quickly run through the protocol of the study. So we first started, of course, with pre-survey study to gather like demographic data and also um, hand measurements, etc. And all of these patients um, we collaborated with, of course, our collaborators in Cornell Medicine, but also with the KnitDema Medical Center locally and at the Cornell. And then we would design a customized device. Afterwards, we would do pre and post measurements of, for example, volume and then movement enabled by the hand, right? And then also there's a 60-minute intervention. This intervention just means they would be wearing a glove and they would be actuated according to the optimal sequence that I've just described, right? And then we also did a post-study interview. And so the main measurements that we took, and this is also in close consultation with our clinical experts, is first of all, the changes in volume through a volume meter, right? And also changes in circumference, especially of finger joints before and after using glove, and also changes in range of motion. So hopefully they're able to become even more mobile, their fingers after. And so again, this is not a efficacy study, but really an early feasibility study. So I'll just kind of talk about some of our early results. So first of all, in looking at changes in volume. So because we did the study only on 5 participants, and as an initial study, not looking again at efficacy, there was no significant difference pre and post, but in the descriptive data that we gathered, 3 out of 5 participants had a decrease in volume, and on average, we observed a 2% decrease in volume on average. So I think while it's not statistically significant given the limited amount of participants we collected, but we found this to be quite promising in demonstrating the potential of this device. And also in this next study where we were testing changes in the participants' range of motion in the finger. So again, there was no statistical significance pre and post. However, again, promising average decrease in terms of descriptive data of 1.7% of the flexing an angle after intervention. So this means that they were able to flex their fingers more after using the glove. So again, promising early results with more data to be gathered in the future. And then finally, we also did finger circumference measurement. To the next slide. Okay, here we go. Okay, so again, no significance, statistical pre and post, but we did observe a 1.46 decrease in the circumference of the base of the finger. So again, I think this feasibility study really demonstrated, I think, of course, the feasibility, right? The safety of actually wearing something like this, and then also I think just promising early data towards efficacy. And of course, more studies would need to be conducted to validate this. And also in our post-study interviews, we conducted a semi-structured interview to understand participants' perceptions around wearability, right? And so I think the overall summarizing this was they found it to be very light and comfortable, which is something that was also encouraging for us. And also about the sensation, right? We're very curious about how it would actually feel, right? To have this kind of sequential compression, right, on your finger. Would it be very odd or etc.? And and so they also described a range of tactile sensations. However, I think the overall reaction was that it was a little bit unusual, but it did not cause discomfort in terms of thermal discomfort or compression discomfort. And we also asked participants to react on comparing the usage of this early KnitDema prototype with their current standard of care, right? And it was a little bit different for each participant, but some of them, they would use in their standard maybe a pneumatic device or to have nano massage. And so I think one important result was that it was much more quiet compared to pneumatic compression. Very compact. So, they felt that, I could maybe carry this around, and also just the coverage of the finger, right? They found it to be much more conformable compared to something like an isotoner glove, etc., possibly due to the active compression that we were able to have in the robotic textile. An interesting thing is a lot of participants mentioned that they really saw potential in using this as a remote treatment device. So they're very interested in actually taking the device home with them. So instead of maybe coming into the clinic to get treatment, every time they could just wear this during lunch or after work and, get more regular treatment. And or to wear it before they went to bed and etc. And they also expressed a desire to be able to program the level of compression. And so, I think a lot of feedback on being able to just further personalize the device. And so we can see that in this first phase of the study, we integrated this, created this principal component prototype of a single finger. And in the second phase, we wanted to extend to the palm. So this is an photo of also an early prototype where we're extending the actuators into the palm. And then, of course, our ultimate final goal is to be able to have a very much more seamless full hand. And again, these are all just very preliminary. And so I just went through the first phase. And so next, I just want to talk about some of our early work that's mostly been happening this year in this phase about how to extend these actuators, right, from a single finger and then to the palm. And okay, one sec. Very good. And so this is an early prototype of the palm attached prototype. And so this is also in consultation with our clinicians and physical and occupational therapists. And so they really encourage us to figure out the palm first and then to create something with hope. And mostly because of the complexity of the lymphatic system in the palm. And so this is a diagram of some of the lymphatic systems in the hand. And then we are in the process of doing a series of, pressure and compression studies to understand what would be the most optimal placement, right, of these SMA actuators in the palm, right, to really mobilize the edema fluid. And of course, and also examining a lot of more advanced digital knitting techniques, right, to be able to knit something with these integrated channels, but it's also providing both passive and also these channels to enable the threading of actuators for active compression. And so on the right, this is a very early test with a patient with KnitDema and trying on the finger and also palm attached device. And so beyond, of course, figuring out a lot of the challenges, right, in understanding how to best mobilize and pattern the actuators in the palm. A very important thing that is driving our second phase is something that we learned in this co-design process with clinicians to create this device. So in our first phase, so we see ourselves, this is like maybe an over-generalization of everything, but we sort of see as the textile engineers kind of designing this robotic textile, right? And so we would often, the way that this co-design process went was that we would get a lot of clinical expertise and guidelines, right, from our clinical collaborators. And then we, the textile engineers, we would then design the device and then give this to patients, right? And however, we really, through our just like, multiple rounds of iterative, we really found that it could be much more helpful if the clinicians, so these experts like rehab doctors, PTO, if they could actually take a role in designing these personalized gloves, right? For the patients that they're treating, right? However, there is something that's deterring this because there's a very high barrier to entry to actually program these huge knitting machines, and just this, yeah. So I think just some of the fabrication complexity, right, and also, right, just not having the clinicians' expertise in the making, it also resulted in textile engineers, us, needing to go through more rounds to actually have the right type of fit to meet their exercise. So in the second phase, we're very interested in also just understanding how we can let clinicians, right, be involved in the design of such a device. So let me jump to phase two. So what we're trying to do to also investigate here is if we could create an interface, right, to let the clinicians be able to take part in the design of the device, and then it would go to the patient. And so, so currently, how we actually develop one of these gloves is we would acquire the measurements, right, from the patients. We would do prototyping. We would then program the knit on our digital knitting machine, and then actually have it fabricated, right? And this fabrication would actually take multiple iterations. And so we're interested in creating a design tool to be able to let our clinical experts, right, to be able to have more input in this phase. So this is also like an early interface that we designed, right, to be able to let clinicians have input in adjusting the design of the glove. So for example, they could enter their patient data, and it would then pull out a diagram, right, of this patient's hand. And then what the interface can do is, okay, so it can then, like, then generate these measurements of the contour of the hands, and then create the optimal suggested, each of these red lines here on the right are the optimal actuator placement channels. And then this can then be automatically generated into a bit file, which is needed for our machine knitting, right? And so here we can see just an early usage of this platform. So this is like an early study where after we got the measurements of the patient's hand, the clinicians, they were then given this interface, and they could then do a lot of adjustments, right, according to their clinical expertise and understanding of this specific patient's needs. So for example, here we can see this clinician doing some adjustments on the placement of these shape memory relay actuators, really according to the individual patient's needs. And so here's just some like early results of this design tool. And then the goal is, again, to really enable a much more personalized device for the individual patient and participant with hand edema. And we, again, are able to do this because it is we can, because of the fabrication portion, we can use the knitting machine to basically customize the glove very, very quickly. However, understanding the right type of actuator placement and design for the specific patient is often the challenge. And so I just want to show here some initial results. So this is so we can see here P4. We can see here, that the clinician, what they did was due to their understanding of this patient's severe muscle stiffness issues, they in this code design, they use the interface to really extend the length of the cuff so that it would be much more easier for doning and doffing, and also just for comfort overall, right? And this is really an insight that we, the researchers, the textile and it would not have without clinical experts. And it also made it much more comfortable. So here's an image of it actually being worn. And another example is of this participant P5. So what happened here is this clinician, based due to their understanding of the conditions of P5, because they had a lot of issues around muscle specificity, right? So they really adjusted the placement of several of these SMA actuators so that it would not, it would avoid the finger joints to decrease their discomfort. And so I think these are just some very early results on how we can, by involving clinicians and through this design tool, this clinician development, to make much more personalized gloves that can be catered to individual needs. And it is very inexpensive to fabricate something. And so, yeah, we were also quite encouraged by some of these early results. And so just some early reflections from a more clinician-led workflow, which is what we were doing here, versus a more technician-led, which is only us, the engineers, leading it. So they really talked about how it was able to become much more streamlined, right? This fabrication process, and be able to customize it for better doning and doffing for the individual participant, person with hand edema. There's also just a much faster turnaround time, right? So being able to fabricate something that's much more catered to the individual hand measurement and their specific conditions, right, in a much shorter time, right? And also being much more considerate of different atomical factors, etc. And yeah, so I think it really proved a lot of improvements, and we're also in the process of extending this design to, of course, to a full hand phase. And so in terms of future work, so let me try and navigate my slides. So yeah, so I've just talked about how we're kind of extending it to the palm attached phase, and our next phase would really be to fabricate a full hand glove. And of course, there are challenges around figuring out how to knit a glove with integrated channels. So we're in the process of doing a lot of research in digital machine knitting to figure this out, and also understanding the suitable sequence, right, of compression of these actuators for hopefully maximum effectiveness, but also taking consideration comfort, etc. And so this is a very important part of our future work and moving towards this final phase. And I think ultimately our goal is really to move towards a personalized rehabilitation device. And, you know, just from, I think, a lot of the early reactions from our participants in the study, and also from our clinical experts, we're also very interested in being able to have this glove used by our hand edema in the wild. And this means just in their everyday setting. So let's say in the future, we might, like a rehab doctor, PT, they would be able to, let's say, prescribe such a glove that can be catered to the hand edema patient's individual anatomical measurements, but also to program, right, the compression levels, the time of compressions, all according to the person's clinical needs, right? And then they can take this glove home with them and, as prescribed by the doctor, use it for as many or few times a day, right? And so it is significantly less inexpensive to fabricate one of these versus having, for example, a manual massage session. And so we're also very interested, as a next step, once we have the full hand glove, is to do a in the wild study. And this really means letting our participants be able to take the glove home and really to absorb, also for us to understand and observe behaviorally, right? How would they use something like this? when would they use it, and how can we also create a better user experience overall for this robotic textile device. And so, I think that I hope today provided a summary into some of our thinking, of course, more from an engineering and design centric view and designing robotic textiles for hand edema rehabilitation. And again, I want to acknowledge our collaborators at Cornell Medicine Rehab Department, Dr. Joan Stilling, for her collaboration, and also all of the team members for their hard work. And I'm happy to take questions, and of course also really appreciate everyone's insight and suggestions on potential applications or other uses for the technology. Thank you. I think one question was around, like, do we foresee this type of therapy being effective for other body parts? And I think absolutely. So we really seeing it as having a lot of potential for more granular body location. Of course, we're starting with the hand, but you can imagine toes or ankles or knees, right? So I think really these body locations that are hard to treat for edema because they're so delicate and intricate atomically, right? So current treatment methods are there, but we just use these. We just, like, for example, use our hands every day, right? So they can also significantly affect activities of daily living. However, each person with hand edema, as we've observed up to this point, they also have just a very, very different symptoms, right? So so I think we're starting, of course, by looking at the hand, but we do see a lot of potential in extending this for other more granular and intricate body locations, for sure. So I see another questions around, like, asking if some of these studies, are they published? And so we have our first publication. So this is on the first phase of the study with the single, and that one is published at ACM Kai. So this is a computer science venue. And if you go to my lab website, Hybrid Body, you can find the KnitDema project. It should be very obvious, prominent. You see the image, and if you click in, we have a link to that publication. And yes, and we will also be having, we're also working on further publications for each phase of the study, and hopefully ultimately the in the wild study. So feel free to keep an eye out on our, and we all update this on our lab webpage. So feel free to keep an eye on that. And okay, I love this question. So are we looking for people with hand to collaborate with you on our? Yes, we absolutely are. Please reach out to us. We would just really love your input. And we are also engaged in, we use what we call a co-design process and also an iterative prototyping process. So all of our prototypes go through a lot of phases of prototyping, and we really, so I didn't have time to cover in my talk today, but we really try and actually interview a lot of clinicians, but also persons with hand edema on how they think something should be designed. And this goes from, the glove itself, but also the software interface. And eventually, when we're going to do this in the wild study, we're also in the process of designing ideally a phone application, right? So that the patient can also press something for the device to start, and with the approval of clinician, maybe adjust some of the compression levels. I think, people with hand edema, with the lived experience, it's always something that we would really value. Yes, and then there was a question about the type of yarn. So we use a combination of elastane. So this is, you can think of it as like the elastic yarns that our yoga pants, for example, are knit with a combination of non-elastic yarns, and to really enable, of course, this stretchability. And sorry for raising my hand for no reason. To increase the stretch, but also for comfort. Yeah, and then we also did a lot of just like wearability studies for the amount of comfort in these devices. And of course, because these gloves, you can knit them very quickly. It takes a couple minutes for it actually to be knit, right? So we can also, of course, adjust the ratio of the elastic versus non-elastic yarns for individual. Yeah, and I think it was a very interesting there's a very interesting question around yeah, when we envision this to be, so we kind of see this as being used like, for example, during a lunch break, right? So maybe um one of your hands could be your hand that needs treatment could be using this device while you're taking lunch, or for example, at when someone at work, maybe they have like a 15-30 minute break, they would maybe they could put on this glove, right? And to rest your hand, like, and then to let it do this compression sequence, right? And another might be like, before, afterward, right? But we can imagine how this would just save a lot of times in terms of like traveling and also just cost, right? Versus having to go into a clinic, right, every time for treatment. Yes, and there was a question about the actuator that we're using. These actuators are ring shaped because this enables them to provide more compression. However, they're super small. So I don't know if yeah. So I jumped through the slides. These slides very good, but actually they're about the size of a yarn. They're very, very, very. They're like so we spent quite some time finding these actors. So they're really kind of like a the size of a yarn. However, they are spring based. And so, of course, there's the other option to use actuators that are just linear. However, something that's linear when contracted, it will provide significantly less force, right? And for this active compression to be hopefully effective, we would advise that using something with more force would be suitable. Yeah. And yeah, so let me just type in, how do I, yeah, so yeah, I'll type in, yeah, just some more questions um, about how to contact us. And yeah, so let me type my email again. So yes, feel free to, and because we're in the early phases of this prototype, and there are just like we're hoping eventually to be able to do a much larger scale study, and we really would value, um, input and insight from lymphedema therapists and educators, and of course, persons with hands actually with lived experience. So feel free to contact us. And yeah, and so I think I've covered most of the questions. Yeah, feel free to email me as well. And yeah, thank you so much for having me.